Welcome to the podcast. It is Faraday and myself talking today about some different treatments that you can do both yourself and medically for ED or erectile dysfunction. So, what are the different treatment options if you're noticing some changes in your erection strength? And we do cover this in depth with other podcasts and other videos, but we're just going to run down the list of different things both you can do that your doctor might offer and that also we could offer in the office.
Your traditional and non-traditional options.
Traditional,
and we're going to go from the least invasive to the most invasive. So you guys are going to want to stick around to hear all the different things that are out there.
And we're going to start with things that you can do. What are some lifestyle things that you can do? So obviously, health issues and medical conditions and medicines do affect erection quality and strength and function. And so basically, the healthier that you can be, the better for your erections.
So diet and exercise is always at the top of every list, it seems like, right? Lifestyle changes.
Yes, absolutely.
So diet, exercise, and sleep. Biggest things you can do that you can be accountable for, that you can initiate change to help with sexual function.
The healthier you're eating, not fast foods, not processed foods, and again, straight up processed sugars. And again, that's the most addictive substance on earth is sugars. So if you can stay away from that, the better. Not that you need to stay away from carbs, and then proteins, obviously, and healthy fats. And we all know that. And that exercise, in addition to just being active, getting outside, getting sun, because supplements such as vitamin D and conversion of vitamin D in the skin is very helpful.
And anytime you can get any exercise in, so cardiovascular health, that makes a big improvement in blood flow. And blood flow is the main thing you all need to get an erection.
And these are the smallest blood vessels in the body, 1 to 2 millimeters. So the health of the blood vessels in the penis are the first. And so it's really a barometer of vascular health. And so vascular health is also determined by us being more active and fit. And so exercising and being active is crucial to both prevention of disease in general and erection changes.
And we talked about sleep, but sleep apnea is also another thing that can negatively affect erectile function because it can negatively affect testosterone.
And it can actually affect weight. So if you're not sleeping well, if you have snoring, which isn't always affiliated with sleep apnea, but usually does progress to, but if there's an undiagnosed sleep apnea, or changes in decreased duration of sleep, then you're going to end up gaining weight over time, which is unhealthy for you and your penis.
And if you want to hear more about sleep apnea, we have a podcast on that as well. So check that out. That'll be being released soon. Correct. So lifestyle changes. What's the second one? So we're just going to slowly step up. So the next step is
supplements, things you can take at home, and again, even nutrition, getting back to that nitrates just real quick. So, we talk about this in supplements, and there's some supplements that will provide you with nitrates as a substance or a substrate for nitric oxide production, which also decreases with age. So supplements you can take, nitric oxide, everyone kind of has heard or are quite aware of L-arginine, L-citrulline as ways to increase your nitric oxide production, but you also need the nutrients for that production. So
exactly. So eating a lot of leafy greens, beets, things that are high in nitrates are fantastic to help with blood flow and cardiovascular health.
And so when we come down to that, also Berkeley Life is a supplement that has all the nitrates in it. And we have done another podcast on Berkeley Life and increased nitric oxide production because that decreases with age. And again, is dependent on nitrates in the body. And so instead of worrying about getting all those nitrates in your diet, which is almost impossible to do as we get older.
You're looking at like 5 cups of raw spinach. So I don't know about you all, but that is not the easiest thing to get in daily, let alone twice a day.
Yes, and about the same with beets, like it's a large amount. And so, you can always do smoothies or some other kind of thing to get those nutrients in, but Berkeley Life is another way to get those in a capsule form that help with nitric oxide production. Vitamin D, vitamin C, there's some other supplements. We have one called Libido Stem for men. And women, but it basically has different things in it, and horny goatweed and
Help
tongue
increase
cut
free
alley.
testosterone.
Yeah, tongue cut alley is another one. So there's definitely some other things that are in those supplements that help to increase erection strength. And Yohimbeam is actually like an older one that was used quite a bit. And you don't hear as much about it, but with some of the supplements, it'll combine that with other things that are necessary for increasing nitric oxide and erection strength.
There are some supplements like ashwagandha that's been a little bit more popular in the last year. We've heard more about that can help with sexual health, as well as
NAC.
Yep.
You know, so N-acetylcysteine is another one that decreases kind of inflammation in the body in all kinds of different organs, including your penis. So that's another one that actually can be used to detox and to improve function. Again, I think that as we're talking about NAC, you know, it's absorbed orally, but glutathione is the precursor. So you're trying to get glutathione. Sorry. Glutathione is the end result. NAC is the precursor. So basically, glutathione is not absorbed orally. So NAC is taken instead and then converted to glutathione in the body. Master antioxidant and very healthy.
Which can help with blood flow.
Correct. So basically...
Are you seeing the trend, guys, that can help with blood flow?
Yeah. Well, the penis is a marvel of science. Again, the blood flow increase in a matter of seconds is 40 to 50 times, and it doesn't happen anywhere else. So blood flow is crucial. Blood vessel health is crucial. Now we're kind of looking at, again, so we've talked about sleep, getting that decreasing stress. Lack of sleep leads to lots of other things, but the more you're exercising, the more you're eating healthy, you know, you just have overall health and cellular health for erectile function. When you actually have some changes that happen despite that, when you go to your doctor, some things in traditional medicine that are offered are the little blue pill or a PD-5 inhibitor.
So that is your Viagra, your Cialis, or your generic versions, sildenafil and tadalafil.
And there's a newer one. Again, we don't use it as often because we use more the combination troche because we like to combine the Viagra and Cialis. And I feel like they change it up a little bit because it's easy to then make a brand name product that might be a little bit more expensive and not offer much benefit. And that's kind of what drug companies do. But I do like combining Viagra and Cialis because you get a long acting and a short acting. And you can do low dose that you can get at your regular pharmacy too, but just not in the same formulation.
That's it. We use a compounding pharmacy locally for troches because we see better results on lower doses that are more sustained. So anytime you can lower the dose, you can lower your potential side effects that are negative.
And they have longevity effects too, like anti-inflammatory, anti-aging. And so while those are traditional options, they're just non-traditional formulations that improve the efficacy and therefore effects and decrease your side effects. And then some other things from a traditional standpoint. So if you're not responding to PD-5 inhibitors, then they progress a little bit. And again,
or hormones. I didn't add hormones in, but that kind of goes around that time too. Typically around the time your doctor is talking about the little blue pill, they may or may not be looking at hormones. But for men, you guys need to be looking at your testosterone levels if you're having erectile dysfunction, because 20% is hormonal.
And then blood flow is the other. So, but I would love to get feedback from men. And when you're approaching your primary care doctor, how many of those are actually addressing the hormonal component, or are you approaching other providers for that hormone
and just getting the pill from the doctor?
Correct. So I would love to hear that, because I do. We see patients all day long that are doing hormones with men and women, and some come from the low T clinics or some testosterone clinics, I should say, maybe not a specific, nationwide brand, but basically. Then also some are coming from the primary doctors and then how they're doing it. So we would love to get feedback about that, because hormonal support, optimal cell health is important. But then adding the pill is usually, in the wheelhouse of the primary care doctor for sure.
Absolutely.
And then what are the next options that might be offered? I feel like if the pill doesn't work, you're probably getting referred out to urology for further evaluation and next steps typically involve injections of some sort when it gets to the point where we've manipulated every single aspect of Viagra, Cialis, newer formulations of that. You're doing nitric oxide and you're still not getting results, and the function is declining and progressive.
And urology is typically doing what's called Trimix, which is an injectable for an erection.
And increasing blood flow. So basically, but you're going to inject prior to sexual performance. So it does require timing and might interfere with those special moments. And then no man really wants to inject into the penis, but it does get you results. No matter what, you will have an erection and can perform.
And then the most invasive is if the Trimix doesn't work.
Correct. And so you can actually titrate up on the Trimix. You can do increased doses. You can double concentrate. You can do quad mixes versus trimixes. And so there's lots of different things you can do, but you're still injecting. And so if that doesn't work, the next steps are implants, penile implants. So,
surgery.
And so again, I think the earlier that you're noticing changes and that you could potentially intervene, the better. And so that's where we veer off into the non-traditional or regenerative offerings. And so
non-traditional options.
That's
a lot that we do here, which leans towards more the regenerative side. So our non-traditional options are...
And now you don't look so bored. Now she's lit up. Like, again.
Well, because it's the same thing. Lifestyle is great, right? We all need to make lifestyle changes. We all can do better in that.
Yes.
Including us. Yeah. We all need to do our part. Supplements, great. Again, we all need to do our part. But I can't tell you how many times I hear, I've been given a pill. It worked. It doesn't work anymore. My doctor didn't look at my hormones, or I had to request my hormones and they said I was normal, but I don't feel normal. And then, or I was told I need to inject something into my penis before sex. And like, what in the world is that?
Yes. And some of them don't know. And I feel like a lot of times looking on the internet, you kind of know where it's going, and some know it's progressing, but they're only being offered certain things and they're looking for other options. But the earlier we intervene with erection changes, the better. So obviously we are all pro lifestyle choices and healthy ones, because that's your part. And so we're all about that. And however we can help. And if you have supplements we haven't mentioned, something that's working for you, we would love to hear about it, because we love to cover those things. And again, addressing the PD5s in different ways where we're combining them. You're going underneath the tongue, making sure people are taking it the right way. But if we're doing that, comprehensively addressing hormones and then regenerating local tissue, which is blood flow and blood vessels into the penis, since function depends on blood flow and lots of it. So
anytime we can do regenerative, she's right. It does light up, because there are so many things we can do to help with regeneration for sustained results. Less invasive than surgery. And you may need surgery. There's a place for injectables. There's a place for surgery. Obviously, we're not doing surgery, but we do utilize Trimix in our office as needed for some patients. But usually there are other things we can do to hopefully not have to remain on Trimix long term.
Ultimately, and again, I think one exception to that might be prostate surgery and nerve effects related to that. Otherwise, we can usually regenerate. It just depends on how much regeneration we need. And that's dependent on where you are when you come to us. And so that's a customized, individualized thing. But we do get excited about regenerative procedures, because while we can do traditional medicine and offerings, we would love to try and get people on the minimal doses of medications and definitely avoid surgeries if at all possible. And I do think a lot of times that is possible. And that's what patients are looking for as well. So regenerative procedures being, acoustic shock wave. And so that's telling the tissue it's injured over the penis and the perineum. So smaller blood vessels in the penis, again, 1 to 2 millimeters, the first affected. And then the larger ones in the perineum to increase blood flow ultimately to the penis for stronger and harder erections and consistent. That's one of the things that we combine with a P shot.
And then the P shot being platelet-rich plasma. So where we draw your blood, spin it down, take that concentrated platelets that are growth factors and then inject those back into the tissue to help with regeneration.
Yeah, and there's lots of growth factors, and it affects nerves and blood flow and smooth muscle. And so it is complementary to GainsWave. And again, we'd love to do GainsWave even prior to a P shot that day, tell the tissue it's all injured again. And again, we're doing a series of it, but then dumping a bunch of growth factors in with the P shot. And then one of our
a little supercharge.
Yes. And again, great benefits, no adverse effects for either one of those. And then one of our newest offerings, which we have loved the results with, is Botox, and adding Botox to the penis and doing that when we're doing a P shot. And that offers us another aspect. And so now if somebody was traveling in and can't travel in once a week or once every couple weeks or once a month, we can do even more quarterly treatments with a GainsWave, a P shot, and adding Botox there too.
So what that does is it forces the smooth muscle to relax. And when the muscle relaxes, when that smooth muscle relaxes in the penis, it helps with blood flow. So anytime we can increase blood flow, the better.
And again, you're relaxing a muscle. People think that the penis is a muscle. We've covered Botox in a separate podcast, but it's not a muscle. It's a blood vessel. It has smooth muscles. And so those muscles we want to relax. And one of the benefits of Botox, again, adding it in, you get the more acute effects, 3 to 5 days. It might last longer than if you were getting it in the face, 3 to 6 months. But you also get the more immediate effects while we're regenerating tissue, which takes a little bit longer. So, and again, you're relaxing the muscle. So in the flaccid, soft penis, frequently it's actually retracted. And so you're actually relaxing it. So you might have a bigger appearance to a flaccid penis, but also then stronger erection. So it's a win-win. And it's not necessary that you look bigger and flaccid, but sometimes that grower versus shower is an issue with men. And so that is one option for improving it.
So just to recap, we can do lifestyle, we can do supplements. We can have more traditional route, which is your PDE5 inhibitors, your Viagra's, your Cialises, having hormones looked at, and then getting a little bit more invasive, looking at trimix injectables, and then surgery options, or the non-traditional, which is the way we like to go, which is more that acoustic shockwave, examples being GainsWave or Wave Tech, and then the P shot, and then Botox.
And I would add 2 more things that we really haven't covered. And more non-traditional is peptides. PT-141. Yes, I know. I knew you were going to light up with that one too. So PT-141 is one of our favorites. Again, it increases erectile function, but it also improves erections in a different way than the PD5 inhibitors. So it's not a blood flow issue, it's a neurological pathway. And so enhances, and again, we're comprehensive. Actually, and even one that I hadn't thought about is vacuum erection devices, because we like to pair those with our GainsWave series. So that
I don't even think about that, because we include that in with all of our sexual wellness packages. That I don't even think of that as an individual treatment, because it's a complementary treatment to everything else that we're doing. So if the name of the game is better blood flow, how else are you going to guarantee blood flow than to use a pump?
No, it is something that we're very comprehensive in how we address things. And so, cellular health is important, so that lifestyle, those nutrients, hormones, but then our regeneration locally. And we do include vacuum erection devices with that, because if you're not getting erections as often and we're regenerating, then we want healthy blood flow, and that's one way to get it. And if you're not having sex to get it because we're still working on regeneration, then the vacuum erection device works. That's where sometimes the scoring system helps. And so if we need to do trimix while we're doing regeneration, we can, because the more you're having sex, the
more erections are getting, right? The more blood flow.
More blood flow. And actually, even the more hormone production you get with, it's a use it or lose it period all the way around. And so we are comprehensive. But IV therapy is another little one that we might occasionally do. So when we're doing supplements and we're actually giving you not even ideas, we're just supporting, how you can get supplements that will help your nutrient supply to the cells. We also can give it directly to the cells and do a lot of amino acids through that as well, like L-arginine, citrulline, all of that. So if you have any questions, anything we might have missed,
Let us know.
Let us know for sure. And Pygium is another one that we covered in the past that improves
That's a fun
health.
podcast. Just go look for it and listen to it.
It's fun for sure. So that one actually increases load and therefore orgasmic strength, but also improves your prostate function. So it's a fun one. Check it out. And if you have any experiences you want to share, any comments, let us know, because we're willing to deep dive into anything sexual wellness. So thank you.